Ladies and gentlemen, our next speaker, I am sure that he will be most likely to listen rather than telling his name. He is a proud son of Dr. A. Srinivasan. He has started his career. Before starting, he has done his MBBS in 1975 and MD in General Medicine in 1980, DM Cardiology in 1985. And he was formerly Professor of Cardiology and Head Department of Cardiology in Madras Medical College. He had his training in cardiology at Hospital for Sick Children, Toronto, Canada from 1957 to 1960. And he came back to India and started the Department of Cardiology at Madras Medical College in India. He was one of the 4 founding pillars of cardiology in India. He has worked as an assistant professor of cardiology at Madras Medical College and professor of cardiology at Sri Ramachandra Medical College, Chennai. More than 40 years of teaching experience in cardiology. Has taught and guided postdoctoral students in cardiology. Has presented and published more than 50 scientific articles in cardiology in various national and international conferences and journals. He is a visiting cardiologist at Mayo Clinic and Tufts University, USA. And he has worked as a personal physician and cardiologist to two former presidents in India. Joined DXN in the year 2000, 22 years with DXN family. And last but not at all the least, he is a crown diamond in DXN. Traveled to many countries across the globe to spread the message of health, wealth, and freedom in DXN. Ladies and gentlemen, today DXN is having 12 million registered consumers in DXN. And out of that 12 million, 5 million registered consumers are under this speaker. And he is having 17 crown ambassadors of DXN under him. So you know very well, the speaker is not just a doctor, but a very active DXN business builder too. Ladies and gentlemen, with pride, pleasure, and privilege, let me take the opportunity to welcome Dr. S. Ranjan. Please put your hands together. The crown diamond of DXN, Dr. S. Ranjan.
Good morning. So it's very nice to be here, almost after 2.5 years. I think I came here in 2020 February for the Wellness Eve. And after going back, in February 20, on 23rd February, March 23rd was the lockdown. Thereafter, all our movements were restricted. Now again we have got some freedom. So I enjoy my stay here because I have been coming here right from 2003. Any of you as a member who are from 2003, 2002 it was started here in Dubai. Any old member? From 2003, 2005, I'm asking 2003. Okay. Good. So right from 2003, I've been visiting Dubai. Of course, my first visit was not for DXN. I came for a cardiology conference, which was organized by one of my very close friends, who was a professor of cardiology in Mayo Clinic, USA, Dr. Yusuf Malouf. So he wanted me to come with my friends, so I came for the conference. It was a big conference with all the legends participating, especially a great teacher in cardiology, Dr. Jamil Tajik. He's a legendary person, and he's from Pakistan, from Karachi. Great man, great teacher. So I was lucky to work under him in Mayo as a visiting faculty. So it's almost 20 years now. I've been visiting UAE very frequently, and I've made a lot of friends. So again, it's an opportunity to meet many of my friends and DXN family members. So good morning, everybody. Good morning. So today I think the topic given to me is about Ganoderma. It's a boring subject. There's a lot to talk about Ganoderma, and end of the day, you get confused, get tired, because so much of information is available on Ganoderma. Let me narrate about my involvement with DXN. It all started in 1999 when Dr. Clarence Stanislas came to India from Malaysia. He was sent by Dr. Lim to start the DXN business in India. Because Dr. Lawrence had his education, MBBS degree he was studying in the medical college at Karnataka, Mysore Medical College, and Dr. Ratna was his classmate. And myself and Professor Vaspalaya's family, we are very close friends, family friends for almost since 1987, almost more than 35 years now. So when Clarence came, he landed in Chennai, and he met Dr. Ratna, and he wanted to promote this Ganoderma DXN company, and he wanted Dr. Ratna's help, professor's help, to start the company, DXN. So Professor Vaspalaya and Dr. Clarence came to my house, and Dr. Clarence was discussing about the Ganoderma and the DXN company. So he's an MBBS doctor. He got his training in UK also. So he was talking about Ganoderma, and I couldn't understand anything. And that time I was working as a professor of cardiology in Ramchandra Medical College. So I used to work about 12, 14 hours a day. So it was a busy schedule for me, day in and day out. Actually, they both came around, I think 10:30 or 11 o'clock in the night. So I spent some time. And then after that, Dr. Clarence became a friend of mine, and he was trying to establish the company with the help of Dr. DXN company with the help of Professor Vaspalaya. So we all joined as a temporary member in 1999, before the DXN was started in India. Officially it was started in India. It was in 2000, April 10th, I think, DXN was officially started functioning, Chennai being the headquarters. So that is how I became a member and came to know about DXN. That point of time, before the company was started, let me share a testimonial, a powerful testimonial which made me think that this herb is very powerful, Ganoderma. One of my friend's patient, young lady, about 25 years, she was suffering from leukemia, blood cancer, monocytic leukemia. We have a very good cancer center in Chennai, Adayar Cancer Institute, and the doctors who examined her, they said that no, she will not live for more than 1 month, because she was so bad, she could not walk, she could not eat anything, and she was bleeding all over from the nose, from the mouth. And she consulted her family doctor, one Dr. Tangaraj, who happened to be my classmate in Madras Medical College. So he called me and asked, Ranjan, I heard that there is a herb, Ganoderma, that you are talking about, and can you share something with me? So that time, the product was not available. Dr. Clarence had brought a few samples. So I took the samples and then passed it down to Dr. Tangaraj, and the patient, sincerely took it. At the end of 1 month, her bleeding came down, and she was able to walk up to the washroom. Second month, there's a much more improvement, that she was able to take something, about 1 or 2 idlis. Then the third month, she improved tremendously, and she almost became normal. And at the end of 4th month, she joined back her job as a school teacher. She was a school teacher, young lady. And when my friend told this, Dr. Tangaraj shared this with me, I couldn't believe. And he had sincerely, Dr. Tangaraj had sincerely, noted all the investigation reports, and all the reports were becoming, gradually to normalcy, and her blood count had come to a normal values. So that's the point of time I realized that Ganoderma is a very powerful herb which can help sick people. Then I started reading about Ganoderma. Clarence had given me some research papers, and I was going through. So I could grasp only very little, and I didn't have the time to go through it also. So I just passed on all the research material to Dr. Tangaraj. So he went through that and he was sharing with me. So when the DXN business started in India in 2020, April, only one product we had, that is RG and GL, that too 30 packings. And the membership was growing, and that time the country manager was, I think, Ramat Povarsan. So the company was doing well with one single product, RGGL, because all the members started promoting as a drug to sick people. Let it be cancer, heart disease, or brain disease, whatever it is, they went after sick people, and then they were giving a mega dose, mega therapy, that is 30 RG, 30 GL. That's around 22 grams of Ganoderma daily. We had very good results, in the sense that a lot of people showed improvement and they recovered from their illness. So with that single product, DXN business was doing well, and almost I think the end of first year we were doing around 10 crores Indian rupees. That's a big business. In those days, 10 crores a company doing, it's a big business. So after 2.5 years only, we got the other products. I think coffee and paste. And that's how the DXN business started in India. I became a member, but I was so busy that I was not able to give time to build my business. As I told you, as a cardiologist, my job was a very challenging job, and 24/7. But professor used to motivate me, saying that, Ranjan, you need to have a pension in the old age. Because I worked in the government for 15 years, I resigned and went to a private medical college because they elevated me as a professor of cardiology. So I was not eligible to get the pension, government pension. Maybe I would have got around $500, $600 now. So that was always in my mind, that when people talked about my colleagues talk about the pension, what I missed. So that was disturbing me. And professor was, he was keeping on reminding me that I need a pension in the old age. But I never had any problem for money, because my father being a cardiologist, I wanted to become a cardiologist, looking at my father. He was a great man. And he was trained in cardiology in Canada, Hospital for Sick Children, Toronto, from 57 to 60. Then came back to India and started the Department of Cardiology in the government hospital, that is in Madras Medical College. And now I am proud to say that we are doing heart transplants in that center. That time, nobody would have imagined that heart transplantation, we could do it in a government setup or even in a private setup for that matter. So that was his vision. So when I graduated, I also said that I would like to go for a training in abroad to US. He said, no, I'll get you a MD here, master's degree here, you do it here, and later on, if you want to go, you can go. Because his commitment was, even though he had the opportunity to work there, he said, I'm going back to my country, and let me start the department of cardiology. Because cardiology was in infancy in the late 50s and 60s. We didn't have this much of technology. I mean, the treatment modality, any field. So now, I think many of the Asian countries, they are doing well in terms of taking care of sick patients, which was not available about 50 years back. And to tell you the truth, I mean, my practical experience, India is the best country where you can get all the medical treatment. One of the best countries in the world. Cheaper, at the same time, you get the best quality of treatment. So we are lucky in that Indians are, we are happy to have that. So I stayed back in my country, and then I became a cardiologist, and I was working there. And that's the point of time in the early in 2000, I became a member. I never focused on the big money. When I first came here in 2003, I distinctly remember Mr. Ghani was sitting in the front row. That time he was, as a consumer, he was there. So he asked a lot of questions, but I could answer only whatever little I knew about Ganoderma. I was answering him. And after that, subsequently, at least twice or thrice in a year, I used to come and share my knowledge. And 2005 was, I think, the Mercure Hotel first, the leadership camp, 2005, I remember. And after that, every year you have that camp. And because of the COVID, I think now it did not happen for 2 years now. Probably this year you'll be having it. So I was lucky that, to be associated with DXN, and I have contributed something to DXN. So God has given me that opportunity. So like that, every one of you, as a member, you can contribute to yourself and the DXN and the society at large. So you should realize that it's a God-given opportunity that you are a DXN. So you must help people in the sense that whatever knowledge you gain in DXN, share with people. DXN is all about sharing. Sharing your experience, sharing the goodness of the product, and caring for people. So this kind of an opportunity, I don't think you'll be able to get this in any direct selling company or a network marketing companies, because almost all the companies, they focus only on the money and business. But in DXN, we care about people. We want people to be healthy. We want people to use DXN products and improve their health. And our DXN products and help sick people. So without health, any amount of money is not going to help you in any way. Money cannot give you health. Money cannot buy you health. As Dr. Asma Munir put it, even you can't get that reflex with tons and tons and tons of money. The corneal reflex, or the blinking. So there are so many vital organs which are very, very precious. Ganoderma is a herb, very powerful herb. It can give you health. It can protect you from disease. It is always said, body is your best doctor. It can correct the functions or the metabolism, and then make you better. One of my friends used to say that he has written a book, The Incredible Human Machine. You can't produce a machine like a human being. So we are lucky that we are born as human beings, and we are unique probably in this universe. We don't know. So it's our primary duty is to keep our health and care for ourselves and the society. So DXN gives you that opportunity so that you can protect your health, you can have a healthy life, healthy family, healthy society, and end of the day, you can do a lot of service to the society. So coming to the subject, this is all I wanted to share why I am in DXN and what I am doing in DXN. Our doctor's job is to just to treat sick people, right? We don't talk about health in our office. Am I right, Dr. Shankar? So if nobody's, no person will be going to the hospital if he is not sick. So health is something very, very precious. So protect your health and stay healthy. So Ganoderma is a very powerful herb, Ganoderma lucidum. And the modern medicine, it's full of toxic chemicals. You know that. And we as doctors, we are educated and trained to handle those medicines. 85% of the world population, they follow allopathy. 15% is an alternative medicine. Some people, they cannot tolerate allopathic medications. Of course, we do have other system of medication where they can be taken care of. So, as I said, Ganoderma is very, very powerful in protecting the health. Why should one consume Ganoderma? For two fundamental reasons. One is to protect your health, and second is for its medicinal benefits, where it can help sick people with the disease. So health is the most precious asset what you can possess. Without health, as I said, any amount of money is not going to be, it's going to be useless. When you talk about health, there are 4 pillars of health: physical health, mental health, social health, and spiritual health. And to add to this list, financial health is very, very important. Financially, you must be healthy. Because to give a better education for your children, for you to have a better living. So financial state is very, very important, and that's why all of us are working, right? And especially this country has given you an opportunity for the expats, to come here, earn that money, send back that money to your family so that your children's education is taken care of, and make sure that your family is fine. So, if you lose your health, obviously you won't be able to do that. Food as medicine, that is a concept. So 2,500 years back, Hippocrates said that let food be your medicine. But unfortunately today, scenario is that food is becoming a poison because of the fast food culture. We have given up all the traditional the foods. So food contributes to lot of diseases. So any food can become a poison. Salt, sugar, fat, water, anything in excess can become a poison. But Ganoderma can never be a poison. It can only be a medicine because it has got so many medicinal qualities. It's a herb used for more than 5,000 years. We know that now it has more than 400 ingredients now, because that much of research has gone in for Ganoderma. So every the component has got some health benefits. These components are basically divided into 5 major headings: triterpenes, ganoderic acid, polysaccharides, adenosine, and organic germanium. You need not remember all these things, right? Because we start with when we talk about DXN, we start about Ganoderma, and it goes on, and it's maybe quite unnecessary to do that. But just for your knowledge, you can say that it contains more than 400 ingredients are there and classified under 5 major headings, and it has got medicinal benefits. It's an anti-diabetic. It can help in painful conditions. It's a powerful anti-tumor. It's an anti-allergic. It can regulate your cholesterol levels. It has got antiviral properties. It's a liver tonic, heart tonic, brain tonic, kidney tonic. There's so many, the elements are there to protect your organs, especially the vital organs. So, Ganoderma is a very powerful herb, and a lot of research has gone into it that now we know one of the highly researched herb is Ganoderma. It can be used in the prevention as well as for treatment. Again, I would like to reiterate that health is very precious. Don't lose it. Right? What is happening today is people are becoming sick at the age of 30 and 40, especially what we call it as non-communicable diseases like heart disease, hypertension, diabetes, cancer. What normally we see at the age of 70 or 80. That's what Dr. Asma was talking about. Premature aging and premature disease. And human beings, Homo sapiens, we are genetically, we are programmed to live for 120 years. How many of us live for 120 years? At least in my opinion, if you are healthy up to the age of 60 years, is fine. After that, due to the aging process, if you get some age-related diseases like blood pressure, hypertension, okay, doctors are there to take care of you, and you can comfortably live for another 20, 30 years, because the sciences are advanced to that extent that many of the diseases can be controlled or cured. So my thinking is that at least till the age of 60, you must be healthy. So there, all these DXN nutritional supplements will help you. Food as medicine, nutrition as medicine, that's a concept. Right? So, don't lose your health. Ganoderma is able to protect your health by 3 basic mechanisms on the body, actions on the body. One is a detoxification function, and in that we have that antioxidant effect of Ganoderma. The immunomodulating effect, it acts on the immune system and boosts your immune system. And if there are certain diseases where when you have a hyperimmune status, it can express itself as autoimmune disease, rheumatoid arthritis, systemic sclerosis, systemic lupus erythematosus, a lot of conditions. So it can help you as an immunomodulating agent and can control those diseases. And the vasodilating effect, that is, it can dilate your blood vessels and improve the blood vessels. So the 3 primary actions of Ganoderma on the body. One is a detoxification function. Your RG does that function, Rishi Gano. Here it is given as a powder, mixture of both RG and GL. Back in my country, it is given separately as RG and then GL, the Ganocelium. GL is for balancing the various body functions. So detoxification is the primary action of Ganoderma on the body. So when the toxins are removed from the body, you are healthy. Ganoderma is 5 times more potent like ginseng. All of you know that ginseng is a very powerful antioxidant. Of course, we have other antioxidants, we give supplements, but Ganoderma is the most powerful antioxidant, and it can totally take care of the oxidative stress. And in the oxidation process, what happens is we talk about cholesterol, and it's an oxidized cholesterol which gets deposited in the blood vessels, and it can lead to blockages of the arteries. So at LDL, when it becomes oxidized low density lipoprotein, that's a type of the cholesterol. And by controlling the oxidation process, it can prevent the deposition of cholesterol in the blood vessels so that you don't get heart attack or stroke. And it gives that vascular protection. Ganoderma is a very powerful anti-aging. Aging is a primary factor which can lead to disease process. As you age, a lot of changes happen. Your memory comes down, your vision comes down, your hearing comes down, your walking comes down, your digestion process comes down. That's a simple aging process. So, the simple fact is that, you must understand that postponing the aging process helps you to stay healthy in the old age. So, Ganoderma, by its powerful antioxidant effect, it can have an anti-aging effect. It can eliminate the free radicals so that it can protect you from the cancers developing in your body. So being an antioxidant, it's one of the most powerful antioxidants. It's the most powerful antioxidant. It can help you in these situations. It's a powerful immunomodulator. And after COVID, all of us, we have started, we have much more better knowledge about the immunity. Before that, however much you talk about the immunity, nobody will care for it. Our immune system is so unique that it can protect you from many infections. And to have a good immunity, nutrition plays a great role. Healthy food. Next to mother's milk, Ganoderma is the most powerful immunomodulator. WHO recommends the mother's milk up to 2 years, madam, 1.5 to 2 years, because the child should get proper nutrition and develop the immunity. And now, in India, we can say that a newborn child at the end of 1 year will get 9 vaccinations. I don't know what is the vaccination schedule here. Then, after the first year, the child will get boosters, like your COVID boosters, right? So, that is basically to protect from specific infections. And with vaccines, we have totally eliminated smallpox. Almost we are going to eliminate, maybe in another few years, we will eliminate polio. But newer and newer infections will come because of the mutation of the virus. I have mentioned this in several of my meetings, that newer, the viruses will come. And this COVID-19, this virus, it's a rogue virus. It cannot be controlled. And the technology, the vaccine technology has developed so much. Initially when we found out the vaccine for smallpox, it took so many hundreds of years. Why thousands of years? Now we can produce a vaccine in 9 months. 9 months. That is a technology that we have developed, but unfortunately, newer and newer infections are going to come. I don't know whether we'll be in a position to develop those vaccines in the future. And in India, we have the basic infrastructure of the vaccine production, and almost 200 crore population is vaccinated. 200 crores. By any stretch of imagination, I don't think any country will be able to do that. What I'm trying to say is that the third world countries, they have developed this technology, and their health care is becoming better and better and better. Because economically, Asian countries, they're not that rich, but still we are able to give them. Most of the Asian countries, we are able to give them a better treatment in par with any of the Western countries. So when I talk about Asian countries, it includes India, Pakistan, Bangladesh, Nepal, so all these countries and many countries, they have developed their health infrastructure very well, very strong. How Ganoderma can improve the immunity? It increases the interleukin 1 and 2 and increases the interferon production, and it can help in improving the humoral, that's the cellular immunity and the blood immunity. The polysaccharide and the ganoderic acid fraction has got the highest effect on the immune system. This is what I mentioned. That is, Giving vaccines, we are giving developing the specific immune status. But what about the general immunity? General immunity, as I said, you need good nutrition, good habits. Why? Even, you are walking, like Dr. Asma said, when the blood circulation is good, you protect your endothelium, your vascular system, so that your immunity level is high, especially in children. You know how many thousands of children are dying every day, especially in the underdeveloped countries. We cannot afford to, have that. So, in terms of, the immunity, we need to protect our children. So, in that context, the specific immunization schedule will help. Ganoderma, being a very powerful immunomodulator, it can improve both the cellular, cell-mediated immunity and the humoral immunity. As I mentioned, when there is a hyperimmune status, you can get into some disease process. When the immunity is very high, the body can kill its own cells. Then it is expressed as a disease process. The classical example being the rheumatoid arthritis. Even psoriasis is an autoimmune disease. That is why, most of you must have experienced that Ganoderma has helped many psoriatic patients. Right? Immunity and cancer. One of the action of Ganoderma to kill the cancer cells by acting on the immune system, because the cancer cells are foreign cells, they are abnormal cells. So they have to be identified and killed by our immune system. So Ganoderma does that. That's how it's a very powerful. Ganoderma is a very powerful anti-cancer agent. The third action is the vasodilating effect. It can improve the blood flow by dilating the blood vessels. Again, Dr. Asma mentioned it. That's a microcirculation, because Ganoderma contains two powerful components, adenosine and guanosine. Both adenosine and guanosine are powerful vasodilators, which primarily acts on the microcirculation. Microcirculation meaning blood vessels which are 1/100th the thickness of the hair. The blood has to flow through that properly. Then only every cell will get nutrition, oxygen. When the microcirculation suffers, the flow is not good, the organ is not going to function well. Right? So Ganoderma has got that powerful effect on the microcirculation, and that's how it is able to give you good health and keep the organ function normal. In the old age, what happens is your blood circulation comes down. That's a primary change. When you are resting, your heart pumps around maybe 4 to 5 liters of blood into your circulation per minute. Right? So when you exert yourself, it can go up to 8 liters, 10 liters, 15 liters, 20 liters. The heart can pump up to 30 liters of blood every minute when it demands, like a trained athlete. And do a 100 meters dash. Right? You want to achieve in 8.7 seconds, then your heart has to pump that adequate amount of blood, so that every cell receives proper oxygen and nutrition. So heart is a very powerful organ, and it also requires proper blood flow and proper blood flow in the microcirculation, both macro and the microcirculation. So heart is a unique organ in the sense that it's not only a mechanical pump, it's an emotional pump. It reacts to emotions, unlike other organs. The other organ which can react to emotions is your gastrointestinal tract, GI tract, because there are a lot of nerve endings. When your stress level is high, Your heart rate goes up, your blood pressure goes up, at the same time, you feel uneasy in your stomach. That is because of the GI tract is highly innervated. So the blood flow is very, very critical in the old age. That is why we say that you need to walk to keep up your blood circulation, so that there is proper blood circulation to every organ in the body, right from brain, to the toes. So vascular disorders are very, very common in the old age. And Dr. Asma said that the largest organ in the body is the skin, right? The largest organ in the body is the vascular system. Yeah. It runs into so many thousands of kilometers. And imagine the heart, how the heart has to pump through that, whole the blood vessels. Such a, lengthy blood vessels. So the blood circulation is very, very critical, and as I mentioned, adenosine and guanosine are two components which are present in Ganoderma. So unique to Ganoderma, that it can take care of the blood flow and the vascular circulation. And coming to the disease process, because I don't want to talk much about the disease, because it's a very controversial area, and when we know something about the disease, we start promoting the DXN products for disease. That's a mistake a lot of us are doing, right? So anyhow, I'll mention few medicinal benefits. It has got anti-inflammatory effect. That means it can take care of your pain and swelling, especially diseases like arthritis. I've seen people, having good relief with the RGGL. Another painkiller is your Morinzi. When you combine Morinzi and RGGL, you get an excellent pain relief. Please do not indulge in taking painkillers unless it's absolutely warranted. There is no safe painkiller. Even one tablet of the painkiller can cause renal shutdown, kidney shutdown. I have seen patients like that. As I mentioned, in allopathy we give poisons. Better you avoid, unless it is absolutely necessary, don't. Unless prescribed by the doctor, don't take it. Don't go to the pharmacy shop and buy the medicine and swallow it. Very dangerous. Right? That's what is happening in some of the countries. Even in my country, in India, you can buy medicine in the pharmacy without prescription. Now they are making it stricter. Can you get any scheduled drugs without prescription here, madam? Is it possible? No, I don't think so. Even an antibiotic, you cannot get. Because you must realize that, they're all toxic chemicals. And especially talking about the painkillers. Because it's used by, every home, I think. They swallow the painkiller now and then. Especially, what is a famous brand here? Panadol? Yeah. Acetaminophen. So it can injure the liver, again mentioned by Dr. Asma. So painkillers are very deadly, and you have a very safe painkiller in DXN, Ganoderma, and Morinzi. Because some of the arthritis, are chronic painful conditions. We are forced to give the anti-inflammatory drugs or sometimes even steroids to control the inflammation. That's a very, very sad situation that we have to do that, because all the medicines have side effects. So, though patients can be helped with RG and GL and Morinzi. Again, coming to that, the powerful effect of Ganoderma, it's anti-cancer. effect. It was discovered in 77. I shared with you my first testimonial, the blood cancer patient. Now we have so much of research information about Ganoderma and cancer. You go to the PubMed, it's full of articles about Ganoderma and cancer. The polysaccharide fraction has got the highest effect. The usual treatment what we give in allopathy is a radiation, chemotherapy and surgery. Now the use of the monoclonal antibodies, they are coming up for cancers. And there was a news clipping about I think they have done a trial on 18 patients about a particular monoclonal antibody, which the tumor cells have regressed significantly. So newer and newer modalities will come for treating such deadly diseases. I think for COVID also we give immunoglobulins. One cocktail, I think it's very popular. Yeah, that's expensive, slightly expensive. Yeah. So for cancer, to add it to the list, there is the list of treatment. The immunoglobulins are catching up. And Ganoderma can basically help these cancer patients. When you talk about cancers, you have good cancers, you have bad cancers. Some cancers, they are amenable to treatment. Some cancers are totally, like sarcomas. We are not able to do anything because of the nature of the disease is like that. So cancer is on the rise, especially in women, breast cancers, uterine cancers, ovarian cancers, and in men, lung cancers, prostatic cancers. So cigarette smoking, one of the worst thing that you can do. Cigarette smoke contains more than 6,000 chemicals. One of the highly toxic chemical which can produce cancer is 2,4-benzpyrene. Right? Smokers, they know that that's bad, but in spite of that they smoke. They know that alcohol is bad, in spite of that, they drink. So when you are concerned about your health, please avoid that. Right? Some people, have come across saying that, doctor, I cannot quit smoking. Let me take this DXN products also, then, let me smoke and drink. I've seen many people doing that. So I just tell them, okay, you can mix this, RGGL in your drink and then take it. They are happy to do that. Whom are they cheating? They are cheating themselves. Right? Because the liver disease is on the rise. Alcoholic liver disease is on the rise. And liver transplant is going to be a major money-making business. Another 5-10 years. Sure. That's why I think a lot of surgeons are becoming liver transplant surgeons. Now the liver transplant surgery, the success rate is very good. 85%, 90%. Again, to talk about the liver transplant, partial liver transplantation, because the concept is, the liver can regenerate. Ganoderma can help in regeneration of the cells. Right? So, cancer is going to be a major problem in the future. For prevention, definitely Ganoderma can help. We talked about this because of the inflammation. There are other disorders like degenerative disorders of the brain, Alzheimer's, Parkinsonism. Ganoderma can help by controlling the inflammation. Another product, which can help the nervous system is your lion's mane. That is good for your nervous system. We don't have lion's mane in India, but lion's mane is good for, I think I skipped the slides. Sorry. We talked about the cancer, now allergy. The lanastone, linseed, cyclooctave sulfur, they can act as anti-allergic. Most of the anti-allergic medicines, they can cause allergy. So, anti-allergy medications are not, may not be safe. So here you have a safe anti-allergic product, Ganoderma, and it can it can be helpful in many allergic situations like skin allergy, bronchial allergy, nasal allergy. Many of the allergies are caused by pollution or the chemicals what we use, lotions, creams, dyes. So be careful about that. One of the medicinal benefits of Ganoderma is that as an anti-allergic. It can regulate your blood pressure. Young people are becoming hypertensive now. So many reasons for that. Excess weight, physical inactivity, excess salt intake. So, when you are obese, definitely two diseases you can get. That is high blood pressure and diabetes. So have a safe BMI, body mass index, which is around 25. The ideal blood pressure will be 120 by 80. Acceptable 130 or 140 by 80. Or maybe 5 millimeters on the diastolic side, 85, not more than that. That too, allowance is for the aged people. So your blood pressure can be a major killer. So be careful in using excess salt in your diet. See that you are active. At least walk for about 30 minutes a day. That's more than enough. Brisk walk. Right? That can control your blood pressure and the diabetes also. Specifically, Ganoderma has got ACE inhibiting effect. That is the angiotensin converting enzyme inhibiting effect. We give drugs which are basically, they act on the ACE inhibition. Right? So, this Ganoderma is able to control your blood pressure. It's a very powerful heart tonic. I mentioned that it can improve the blood circulation, especially the blood circulation of the heart. It can lower the blood pressure, thereby reducing the stress on the heart. So it's a very powerful heart tonic. It reduces both cholesterol and triglyceride. Now the cholesterol theory is questioned now. So we should have more of good cholesterol and less of bad cholesterol. Our virgin coconut oil, is a good cholesterol. So you can use it for in the cooking. You can drink it also. The benefit of taking virgin coconut oil, it helps the brain. It contains more than 50% lauric acid. Right? That's a good cholesterol. And secondly, it can help your GI tract, digestive function. And also it is supposed to act on the colonic cancer cells. So there is a lot of research going into it. Virgin coconut oil and the colonic cancer. So ideal, keep your total cholesterol below 150, if possible below 130, and your bad cholesterol below 100, ideally around 80 or 70. So high density lipoprotein is cardioprotective. Is there any drug which can control, increase your good cholesterol? There is no drug. Right? So you have to primarily, regulate your fat intake and also exercise so that you increase your good cholesterol. So lower cholesterol is always better. But you need cholesterol. The brain needs cholesterol. So don't think the cholesterol is a bad substance. Cholesterol is required by the body. But your bad cholesterol, LDL cholesterol, that's oxidized LDL, that's the culprit. So Ganoderma being a very powerful antioxidant, it can reduce the oxidation of the LDL and prevent the deposition. At the same time, it will reduce the bad cholesterol. It can stimulate your brain functions, memory, it can make you brisk and active, your sleep function. That's very, very important. A lot of people, they have problems associated with, sleep. In a day, you need about 6 to 8 hours of sleep. So, late night, don't do this, the mobile, use the mobile phone. 10 o'clock, 10:30, you switch off your mobile phone, right? And your television also. So 6 to 8 hours of sleep we require, and Ganoderma can reduce your stress level, improve your calmness of the mind, and thereby it can give you a good sleep. It's a herb of spirituality. By calming down your mind, your spiritual level can improve. Spiritually, being healthy is very, very important, right? So it can help in the spiritual function. And for diabetic patients, it's very good in the sense that it will be able to control your blood sugar and the complications associated with diabetes, non-healing ulcers, neuropathies. So I have seen, patients, they have prevented amputation, going for an amputation. Two mechanisms. One is, it increases the blood supply so that it can promote new cell formation. And the second thing is the improved blood circulation. That way, it can help in the complications due to diabetes. It's a powerful liver tonic, brain tonic, kidney tonic. The organic germanium is associated with all these health benefits. We talked about it, that detoxification is one of the powerful effect of Ganoderma. Your RG does the detoxification. GL does the balancing function. Every organ, every cell has to function normally, and GL takes care of it. That is why Dr. Lim is giving as RG and GL. I don't know any other company is giving RG and GL separately. I'm not sure. It regulates many of the organ functions, digestive function, the hormonal levels. It can help in infertility, and ultimately, it can take care of the pH of your blood. The pH of the blood is slightly on the alkaline side, around 7.6. So when you want to be healthy, you have to stay alkaline. Not too much alkaline. And most of the products, almost all the products of DXN are alkaline food. Right? So take less of acidic food. Acidic food is also required for the oxidation process, but take less. 80% should be alkaline and 20% should be acidic in your dietary pattern, right? You still need acidic food, but highly acidic food, it can harm you, like fast foods, fried foods. So you can avoid that. Ganoderma is a very powerful regulator of body functions. I talked about this, the regeneration function, when we talked about the liver transplant. The ultimate, the action of Ganoderma is that improving the regeneration function. When you take Ganoderma for a long time, 5 years, 10 years, 15 years, you are supposed to get the power of regeneration. Regeneration means, you are able to keep up the cell population, and supposing you have 1 million cells in your kidney, you have to maintain that 1 million cell population for the kidney to work properly. It is said, generally said, that when the cell population drops by 40%, then that organ starts failing. Let it be heart, let it be brain, let it be kidney, liver, whatever it is. So the cell population is very, very critical in determining your organ function. As you age, the cell population comes down. So Ganoderma, it helps you to keep up the cell population. Not only that, it can help you in regeneration of the cells. Regeneration, basically, the body has regeneration function. You cut the nail, it grows. You cut the hair, it grows. You cut the liver, it will grow. The only, cell we were taught in the medical college that, it is, which is not able to regenerate is the nerve cells. Now, even that Ganoderma has shown that it can regenerate the axons, the myelin sheath of the axons. That is how it is so powerful in controlling the diabetic neuropathy. Because diabetic neuropathy is due to the demyelination of the axons. Okay? So you must have seen a lot of people with diabetic neuropathy being helped by Ganoderma. That's a regeneration function. So the ultimate benefit of taking Ganoderma day in and day out, and for lifelong, it will give you it will help you to regenerate your cell function. It's a powerful adaptogen, being that it is non-toxic, absolutely safe to take, and overall it has got an effect on the body functions. In India, the labeling will be there: non-toxic, non-sedating, completely safe in RG and GR. It's classified under, the licensing is done under Ayurvedic proprietary medicine. And in a couple of countries, I think China and Singapore, it's licensed as traditional Chinese medicine. Almost in all the countries, I think it is as a food supplement, including the Western countries like United States, Canada, Australia. It's a food supplement. It's not a drug. Rishi is a very powerful adaptogen and can protect your health. It's a powerful, it can take care of your stress. It's an anti-stress herb. Because stress is a major problem. It can lead to many diseases. So it's an anti-stress herb. By calming the mind, it relieves your stress. How much Ganoderma to take? Again, that's a big question, in the sense that always it is said that you need to take a high dose of Ganoderma. Ideally, if you are able to take around 4 to 5 grams of Ganoderma daily, that's enough in most of the situations. That is I think it's around 2 scoops. 2 scoops? Yeah, 2 scoops a day. But when you have a disease process, you need more Ganoderma. Maybe you can take 10 grams. If the disease is severe, maybe you can take about 15 grams. Diseases like cancer, you need to take around 22 to 24 grams of Ganoderma. Specifically, Dr. Lim has brought that Mycovita. Each sachet is 12 grams. So it's, for cancer patients, it's easy to take. Mix it with Morinji, add some Roselle to it, you can mask the bitterness of the Ganoderma, patient will comfortably, he will be able to take it. So the high dose Ganoderma is required only for patients with severe disease, along with medications. Please don't say that, stop the medications and advise only DXN products. Medicines are meant for the disease process. But unfortunately, the allopathic doctors, they may not know about Ganoderma, and they said, I have seen many of my colleagues saying, who gave you this Ganoderma? Put it in the dustbin. Because we are focused only on drugs, allopathic doctors. Like that, every system of medicine, they have their own do's and don'ts. Me also, when I initially heard about Ganoderma, I had my own reservations. But when that first testimonial happened, I happened to read about the articles given by Dr. Clarence, and I came to know that, it's a very powerful herb. And in allopathy, 70% of the medicines are derived from nature and herbs. So, the allopathic medications not 100% chemicals. 70% they have a plant base or a natural base. For example, I can tell you that for heart failure, we give digoxin that has got the capacity to improve the pumping capacity of the heart. It was discovered about 300 years back by Dr. William Withering. Used to read that story. That is only drug of choice today for heart failure. There is no other drug. Like that, many anti-cancer drugs, vincristine, vinblastine, vinorelbine, paclitaxel, docetaxel, so many drugs. Why? For malaria, cinchona bark. So, this is a God-given, herb, which will help us not only to maintain the health, but in disease situations also. So this has to be taken only as a food supplement. I thought I will, I'll take only 45 minutes. Once I start, it keeps on going. Because I'm not giving more of scientific information because I'm not a research fellow. I'm an allopathic doctor, I'm a clinician. I think most of my lecture was based on the practical knowledge, whatever I gained in my 22 years of DXN and the common problems. You need to stay healthy. Health is very, very precious. Right? So, when you recommend Ganoderma to your friends and relatives, definitely you will have resistance. Don't try to sort of convince them. It's a difficult situation, but over a period of time, definitely they will come to understand that these products are good. Because when I started also I had a lot of resistance from my family, and now my mother is taking it. She's 88, and she's taking Ganoderma for diabetic neuropathy. She has got excellent result. And for the past 15, 16 years, she's on Ganoderma. It's very difficult to, convince your family member or your own brother or sister. So, promote Ganoderma in your family. First of all, you take. Then only your family members will be confident to take. Whatever product, you want to take. Let it be coffee or let it be any beverages. So they all have health benefits. So I think I gave a long lecture. As I said, once I start, it keeps going. So how many of you are members here? All of you are? Is there any newcomers or prospects? Those who are not members? How many? Please raise your hands. Okay, there are very few people here. You join the wellness revolution, okay? Which is started by as far as DXN goes by Dr. Lim Sujan. So we must be thankful to Dr. Lim Sujan for giving us these products and the opportunity to build our business also, our income. So I wanted a residual income. I'm happy that I'm getting a residual income as a crown diamond. After the COVID, I'm retired from a profession, right? I'm 100% retired. As a cardiologist, one should be making. So I thought, okay, let me stop at this level. And then, enjoy the pension from the DXN. Whether you like it or not, 10th of every month, your bonus will come to your account. I wanted only $1,000 as a pension. I'm getting much more. That's given by God. And more than that, what I have earned in DXN is, lot of friends. Lot of friends. So many friends. I really enjoy that. And I'm thankful to my sponsor, Professor Vasupalaya, for giving me this opportunity. And also Dr. Lim Sujan for giving all of us this unique opportunity to be in DXN. Stay healthy. Wish you all the best. And promote health everywhere, wherever you go. And promote DXN. Thank you very much.